Hi, my name is Michael Lupa. I'm an otolaryngologist at Penn Medicine, Becker ENT. Chronic sinusitis is one of the more common disease entities people go to see the doctor for. Surgery for chronic sinusitis is very successful. Primary success rates are quoted between 80 and 90% with symptom control. Unfortunately, 10 to 15% of people will go on to need a revision sinus surgery. Reasons you would need a revision sinus surgery are recurrence of your symptoms, pressure in the face, discolored mucus, loss of sense of smell, recurrence of nasal polyps. Polyps are benign growths that people with chronic sinusitis often develop. Or you just need to see the doctor too many times a year getting antibiotics and steroids, which have their own side effects. There is a point where the number of courses of medicine gets you to a situation where the benefits of a revision surgery outweigh the risks. Chronic sinusitis by its nature is a chronic disease, but there are things that we can address and think about a little further if someone does need a revision sinus surgery. Often there are host factors. How is their immune system working? Do they have underlying allergies? Do they have an underlying immunodeficiency? Conversely, do they have an underlying autoimmune process where the body attacks itself? Often these questions can be answered by a good allergist who's definitely part of the team in taking care of chronic sinusitis. Another thing that we can think about in a patient that requires revision sinus surgery, what was the infectious agent that caused the initial problem? Is it a certain bacteria will create things called biofilms, which are basically analogous to what you see in your shower on the wall. They're multicellular aggregates that kind of make the bacteria difficult for your body to address and for antibiotics to address. Taking a good culture from the chronic sinusitis site, modifying your treatment for ways that address the biofilms may allow you to overcome this problem. Sometimes you can have a fungal organism that's there. Sometimes you can have a fungus ball, something called a mycetoma, which can be, unless completely removed, will recur. It's sometimes difficult to know just how severe a case of sinusitis is going to be and how aggressive one needs to be with the initial surgery. You may think that you need to only open a few sinuses in the head when you need to open all of them. Another major issue is scarring. Sometimes you can't control how the patient heals up, even in the best of hands. One thing you can do to mitigate the need for revision sinus surgery is go in typically a little bit more aggressively than you think. Open more sinuses to allow for better irrigation, better delivery of topical medication. Also, being very careful in the postoperative period to address scarring early is a very important thing. One thing that's an exciting new development is that there are drug-eluting stents that we can place in the patient's nose to help prevent scarring and improve outcomes. From a surgical standpoint, if a patient requires multiple sinus surgeries, we move beyond the initial functional endoscopic sinus surgery, and we open things up wider to allow for delivery of topical medications, steroids, antibiotics. We can open up the frontal sinus, the forehead sinus, more widely than is physiologic to allow for delivery of medications. There are other techniques where we open up the cheek sinus exceptionally wide to allow for delivery of medications. These techniques are not for standard sinus surgery and are only reserved for severe cases. If you have any questions or would you like to make an appointment, please contact us at Penn Medicine Becker ENT.